Lauren. I'm excited to talk about AI-powered precision medicine for sustainable healthcare. And this is something I'm super passionate about, and I guess many of you are if you're listening to me in the call. Um, as I also indicated, I'm really passionate about making a difference to physicians' lives, individual lives with AI-powered insights. I believe that it can make a difference to their lives every single day. I'm with Philips. I'm heading the global data and AI innovation. And hey, that's a great role to be. You can make all the difference. So let's start with AI opportunities that we see for sustainable healthcare. So first of all, I guess we're all aware of this unsustainable burden, whether it's for aging populations, and we are seeing a rise in chronic diseases, let's say, staff shortages we're hearing every single day. At the same time, healthcare, we want to optimize, we want to reduce costs, make it more efficient for clinical staff. And at the same time, individuals, you and me, we are interested in taking control of our own health, being more empowered to manage our own health. And for achieving all this, there's a lot of untapped potential in the data that can be actually translated with AI into actionable insights. That's actually helping with more sustainable care. Data is growing every single day. Well, if you take Philips devices itself, we are generating a lot of information through our imaging devices, through patient monitoring, through wearable devices, through pathology, and more. And it's not just us, right? There is so much going on every single day in terms of patient monitoring, and the data is just growing, and we can be tapping into that to create more value. If you look at the global disease burden, and that's also not getting better, whether it's cardiology diseases, oncology, neurology, and here you're seeing a lot of really critical diseases that we could be making a difference. So at Philips, what we also do on a regular basis, a yearly basis, we collect feedback from a wide number of stakeholders to really understand their priorities. So that means healthcare leaders globally, what are their priorities? How are they making their investment plans? And if you look at AI, they're focusing on better patient outcomes. They're focusing on helping staff with clinical decision support. Of course, they want to, let's say, optimize and improve operational efficiency of their staff. And at the same time, I showed you all the data that we are creating. So how can we actually create more integrated diagnostic insights to come to more precise care? Let's say precision medicine is about more precise diagnostic results that's helping to identify more personalized treatment and thus improving also the outcomes for the patient. So what do the clinical staff expect as return on these insights? What do they want to improve? They want to improve, for example, let's say reducing the length of stay of patients so patients can go home early and get healthy early. They want to reduce readmissions, which can be costly or actually impacting or worsening the patient health outcomes. They want to get it right first time, like get the diagnosis right, the treatment right first time. And ultimately, it's all about improving the satisfaction of the clinical staff, of the patients while they're using our solutions. And ultimately, we want to improve the total cost of care and decrease that. So at Philips, we believe in enhancing the human experience. So AI is about enabling the humans, enabling them to make better decisions, enabling them to go towards more precision care or precision medicine. And that means while we enable them to do that, that we let them do what they do best. That's preventing better diagnosis, right treatment first time, and also enabling better monitoring of patients so they can go home early. Well, AI is advancing at such a fast pace, and if you really look at now the generative AI, the whole boom and the hype that's going on, Well, actually, it's more than a hype. It's becoming a reality. It's really helping us make a difference. I mean, we're already seeing articles like this where ChatGPT is helping with the diagnosis or the differential diagnosis. I mean, imagine how much improvement we can make in healthcare over the coming years. Um, and here, statistics show that healthcare is also one of the also one of the largest markets where there's a lot of investment going on, and it shows that it's going to be like the third largest market. So if you look at media, entertainment, retail, a lot of focus on generative AI there, and of course, healthcare and life sciences is a key area. But what do we want to do with generative AI in these areas? Ultimately, it's enhancing the clinical experience, clinician-facing applications, and you have the patient-facing applications. So, for instance, companions that help in decision support, in documenting information, in improving workflow, or companions that help patients better manage their own care. And I will show you some examples soon what Philips is working on that gives you a feeling for what these kind of solutions could look like. I like this quote as well from the CEO of Kaiser, or let's say former CEO. He talks about ChatGPT, or actually it's not literally ChatGPT or other forms of generative AI becoming the companions for physicians. I mean, he believes that there will not be any physician who wants to practice high quality medicine that will do so without using the assistance of AI in now or in the near future. Well, we saw a lot of opportunities, but of course there's risks as well with it, you know. And if you think of the human experience, I hope, you know, it's not going to be like this, where the patient is eagerly waiting for the diagnosis and the clinician says, let's wait and see what ChatGPT is showing me, right? So that's not going to be the case. It's really helping them do better what they do. So from the opportunities that we saw, let's look at AI-powered precision medicine with some concrete examples of what we are already doing and what we're envisioning to do and enhance further. But first of all, what is a value in healthcare? You know, to reiterate some of the points that I already mentioned, it's about improving quality. That means improving the outcomes, the health outcomes, while improving the patient and staff experience when actually using our solutions. And it's about lowering costs of care. And I would look at it from a total cost of care. So every insight that you gain at a particular point of time, it helps you to prevent something in the future. That means you are really improving the total cost of care or the life cycle of the care. And ultimately, what you want to have with all the data is this integrated insights, a holistic information about the patient, the longitudinal information, what happened, what was the history, did they have a treatment before or not, what is the current information showing them, whether it's imaging, wearable, pathology, omics, how is that, and what is the environment, right, that they are in, because it also has a big influence in better decisions and the whole sustainable care. So if you look at turning data into actionable insights or AI-based insights, it's along the life cycle, it's along the pathway. So it could be in terms of personalized support to take better management of their lifestyle and prevent diseases. It could be about better diagnosis, being very precise, catch, let's say, disease indications really early, prevent them from getting worse, prevent secondary events. So it's all about prevention and diagnosis and catching things early. And it's about treatment and getting it right first time. You know, deciding if a patient needs treatment or not. And if they don't need to have aggressive treatments, then don't do that, monitor them. And if they need treatment, try to be as minimally invasive as possible. And then really making sure during the treatment there is enough assistance for the clinicians and so on to give a more personalized treatment to reduce side effects and complications down the line. And ultimately enabling patients to go home early. You know, we talked about reducing readmissions, but enabling them to continue monitoring their own health when they're home and connecting to clinicians where needed. So a lot of possibilities along the whole care pathway. Let's look at some examples, but I also like to use some quotes from clinicians, from leaders who are actually making a difference in healthcare or in health tech. So first of all, here, Ches Partovi talks about, imagine with solutions like generative AI, when we talk about empowering patients, how can the patients talk to the information, be actually, clarify, what am I seeing? What do I now do? And generative AI enables them to do that. Take this example, really simple patient, let's say a sleep apnea patient at home, wearing their mask, making sure that they are in good condition. They want that feedback. They want to be able to interact. Why are there disruptions in my sleep last night? What can I do about it? What was the reason? So imagine they could actually interact with the solution, get enough information to take charge of it. They don't have to consult a doctor for every single thing. So this is about empowering them. Then, Dr. Allen talks about, as a radiologist, one of the problems is you don't have the holistic information about the patient. You don't know why the patient was there. Did they have a treatment before? What did they have some side effects or complications with that? I need to know that. Is there a pathology result already available? Is there a genetic result already available? I could use all that information to be more precise with my current radiology report. And they struggle with that just because all the data is also in silos. And that's important to change. So again, one of the areas we're focusing on is, as a radiologist, how can you quickly give them the full patient context? So collect all the information from the wide sources, highlight the most relevant information that they have to pay attention to, and they can use that for the next radiology read that they're doing. Same for the pathologist, really. So if the pathologist is looking at the image or the pathology data, the slide, imagine if they could ask that slide, show me all the abnormalities. It's not so easy for pathologists from morning to evening to have the same attention, make sure that they didn't miss any cells when they were looking through the, looking through the image slide. Imagine if they could ask for assistance and say, show me everything, make sure I didn't miss anything. Again, a little illustration, looking at the pathology slide, saying, hey, highlight me all the abnormal cells, the cancerous cells, and AI could say, look, I found 3 areas, I'm highlighting it for you, make sure you don't miss any of that, right? But the pathologist is still in the control to continue his own observations and diagnosis. Same with radiology, you don't want to miss anything. Again, AI could assist by saying, show me, let's say, the initial findings, create a sort of a report or a hypothesis, and then the clinician could still find something and say, oh, you know what, I'm spotting one more suspicious nodule. Can you highlight that for me and also add that to the report? So the AI is really assisting them. And all this, I hope, is helping, on one hand, enhance the experience, relieve the burden that they're seeing today, because they have to pay that attention for so many cases from morning to end of the day and long hours, and all assistance can help them improve the accuracy and precision of their results. Also, just highlighting some more examples of precision medicine, but also sustainable care. Here, AI, we are using a technique to enhance the speed of MR acquisition. So on one hand, you're increasing speed, but on the other hand, you're actually increasing also the resolution and the quality. And if you're able to do that, remove all the noise and so on, then you can even do better quantification. You can see things in that image, even the smallest, let's say, tissue changes, which is not visible to the naked eye. And there is so much more information you can capture about the disease early. So also another example of sustainable care. One of the areas we highlighted at RSNA just last week, the world's biggest radiology conference, is taking our solutions like PACS to the cloud. Again, cloud enables, let's say, reducing the footprint, the carbon footprint, reducing the storage, and really making it more efficient for us. So this is where taking the PACS to the cloud, improving with AI the operational efficiency. Imagine AI prioritizing the cases, already doing preliminary assessments, showing the hypothesis, like I showed you in the examples earlier, asking, or let's say, pointing clinicians to the right areas that they have to pay attention to. That's going to be really helpful for their workflow. A quote from Bert van Meurs from an image-guided therapy perspective. So all these insights in precise diagnosis is great. You're deciding who needs to be treated or not. But at the same time, within the treatment, let's say in the treatment areas, you also want support. You want to make sure you stratify the patients. You are deciding what is the right treatment pathway for them. I mean, of course, treatment is not literally, oh, there is a surgery. You know, you have to precisely plan it. You have to know the treatment, let's say surgical volume. You have to know which organs you want to avoid. So there's a lot of precision required there. And you want to make sure that, you avoid side effects like maybe potential risk of bleeding or other complications you might have. So AI can really help in improving the precision of treatment, thus ensuring right first time success or successful outcome. Here's another example where we fuse information like from X-ray and ultrasound, guiding the catheter in the right way, also giving information about the device, where your catheter is relative to the soft tissue, but also quantifying information along the way. For example, if it is a stenosis case, or how much stenosis is there, what stent you might want to place, which type of stent or resource you will need. So again, a lot of assistance to improve the precision. And all this, like I was saying earlier, that enables clinicians to pay attention to what matters the most, meaning the patient condition and improving the outcomes. Another area, I talked about administrative burden, giving you examples what they are. This is another one. During the procedure, you want to capture all information about the procedure. You need to have a record of that to enable the next step in the care pathway, to create the report for the patients as well as for the administrative next steps. Imagine if you can capture all that: voice recognition, natural language processes, generative AI techniques, really to capture everything. So somebody doesn't have to type that and capture everything after the procedure, which again is additional work. Here is another example. Now, you're looking at a patient. What does precision medicine mean? I mean, can I use knowledge about other patients, similar patients that I've treated before? And it's not just about similar patient. You're looking at things like, did they have similar conditions? Did they have also diabetes and cardiac combination? Did they also have an oncology treatment before? What kind of treatment did we recommend them? What was the outcome? So you want to have more holistic information about other similar patients that you can use as knowledge for your current patient, again, to make a more precise decision for them. As an example, you're looking at a radiology case, you're saying, okay, show me other similar patients with similar conditions. You see a few different patients. You might want to zoom in a bit further and say, okay, but I'm also looking for patients that had diabetes. Okay, great. But then I'm also looking for patients that were also having this medication in parallel, because we believe that that medication might have an influence on this disease. So show me, filter it down to the most essential information that I can use right now. Cardiologist Dr. Alexandros, he believes that AI is really going to help in cardiac case to detect and quantify critical areas like myocardial fibrosis. I mean, AI can make it more accurate than clinicians can do manually, right? So it's not about replacing them. AI is helping them. They're using that information to determine, okay, the patient has myocardial fibrosis. Now, what do I do? What is the best way to treat? Taking the patient's preferences into consideration, maybe other, let's say, their insurance status, their family situation, so many things into consideration to decide what might be the right treatment selection for them. And I was highlighting earlier, while you're doing the treatment for the patient, how can you collect more information, generate a log, generate a report, and this is also going to, and while you're doing the treatment, if it gives you assistance as you go along, what you should avoid, oh, there's a blockage here, that's going to be really helping the physicians. After the treatment, let's say the patients may have to go to an ICU or a ward. I mean, not every treatment you can go home right away. In that case, again, AI can help to reduce, let's say, patient's condition deteriorating, right? You want to capture things early. For example, AI can help reduce the number of cardiac arrests that patients have in ICU if you identify their, let's say, heart rhythm disorders early and the condition early. So that's, let's say, we are monitoring the patients in the ICU, and nurses or clinical staff can really say, what do I have to pay attention to? Show me the abnormal values. Show me the most critical one. Show me the, there might be 2 or 3 conditions that are deteriorating, but you could ask AI, show me the ones that I have to immediately intervene on. Which medication or what treatment should I immediately act upon? So that's the kind of help that AI can offer to improve care. And, I was saying earlier, every indication you capture early, you do the treatment or intervention at the right point of time, you avoid that side effect, you avoid cost down the line, and ultimately you improve, sustainability of the whole care life cycle. And AI can also assist in many other aspects, like forecasting. How do I plan for the patient flow and best optimal patient flow next week in my diagnostic wards or my emergency centers? How do I make sure that I have all the right resources in place at the right time? Now, when the patients go home early, and it doesn't mean that, hey, now I can casually sit at home and chat with my physician with no pants on. That's not the point. But you can really capture all the information, including wearable devices. And again, AI can assist you in identifying abnormalities. And I showed you earlier, patients can talk to their charts. And ultimately, when they really see some, let's say, heart rhythm disorders, after a stroke, if they've been treated, heart rhythm disorders, you want to know that. And then you know exactly when to go to your clinician. So I showed you a lot of examples about where we are working on as Philips and where industry is going towards all contributions in making healthcare more sustainable, but it doesn't come without challenges. And especially with generative AI and all the new techniques coming in, it just makes it more and more challenging. Hey, but there is no fun without challenges, right? It's always a balance. And as Shaz puts it here, there is always a balance between regulation, compliance, and innovation, but it's absolutely essential to take care of regulatory considerations. But at the same time, the solutions need to work in the clinical workflow at the point of decision making. It should be convenient. There should be clinical acceptance of the solutions. Otherwise, it's just technology. So, hey, when we talk about regulatory, again, we as technology providers, at the same time, even the clinicians as healthcare providers, they cannot say it's not our problem, it's the AI, it's the AI that did the diagnosis. That's not the case. We are responsible for the solutions we developed. At the same time, clinicians are also responsible for the decisions they're making with that assistance. We all have our roles to play. AI can only assist you, and it's up to us to make sure that the AI is compliant, it's robust, it's transparent, explainable, and doing all the right things for us. So the challenges, of course, vary from do we have the right data? Are we introducing any bias? How can we build trust in the AI? How do you make sure it's performant and has the right accuracy? How do you make sure you're empowering the human? How is the human experience enhanced? You're not bypassing them, you're helping them. How does it fit in the clinical workflow? What regulatory standards do we have to keep up with, and even support the regulatory authorities to develop them? And at the same time, what are the new business models, right? It's an ecosystem. Data needs to flow in that ecosystem. There is a win-win business model we all need to generate. Otherwise, each party cannot create a whole sustainable healthcare on their own. All parties have to, come up with this nice win-win ecosystem to be able to achieve that. We do have our responsible use of data and AI, our practices, our principles, when it comes to data privacy and security, when it comes to human oversight, fairness, transparency, robustness, and so on. And ultimately, it's about making sure what we do benefits human beings. It's creating a benefit for patients, for customers, for society overall. We also follow a very structured approach to creating our AI solutions, our AI propositions. And I always say, hey, really start with the need. Again, taking sustainability factors into consideration, understanding which outcomes you want to improve, which performance indicators you want to matter, and then work backwards from there. Then you think about what value, how am I going to generate that, what data do I need, what is the right AI solution, how do I make it robust, what is the, let's say, capabilities that I need in order to develop the solution, how do I implement, how do I deploy, how do I monitor that, how do I think of sustainability as a whole. That means the whole life cycle of the AI solution. And that's where, continuously, if you take a structured approach, you get clearer and better ideas how you're going to create more care, let's say more value over time. So ending with a couple of slides, it's a loop. AI insight, it's not that you end with the first insight. Every new data enables you to create new insight. So you want this connection between the lab, or let's say how you create the solution, and how you deploy and get the feedback from the real world. And literally, there are so many people out there, there are so many conditions, so many different workflows, so many different environments. You cannot anticipate everything. You've got to have that continuous feedback. And I like this, I call it the symbiotic relation, on one hand between data and AI, because the better the data, the better the AI. And the other hand is a symbiotic relation between the R&D or the lab world and the real world, right? They support each other. And it's a symbiotic relation between the AI and the human, right? The human is creating the AI is helping the humans. So it's this loop and the symbiotic relation. It's just fascinating how you can create continuous value over time. Well, if you talk about creating value and, we are saying empowering, and it's definitely not going to be like this out with the clinicians, in with the AI. It is not the case. And I really like also this quote from Dr. Allen, where he said, with an AI-enabled future, the physician's emotional intelligence, how they work with the patient, how they really help to identify the right care for the patient, and so on, is much more important than the IQ. It doesn't mean the physician has to know everything. I mean, it's absolutely not possible for them to know about all other similar patients, and how do I look at this information from this high-resolution MR to, oh my God, this patient has gone through so many different treatments and medication. How on earth can they, comprehend all that? So it's all about synthesizing the right information, using the help of AI to come to more precise decisions, or precision medicine. So it's a teamwork. The human and AI experience is a teamwork, and only through teamwork we can come to more sustainable healthcare. So I'm going to end with key takeaways. So first of all, healthcare is going through significant challenges. We know that. whether it's aging population or rising costs and limited resources. We know that we want to help to make it sustainable. Precision medicine, it's about tailoring the diagnosis, the treatment, getting it right first time for every individual. And AI plays a key role in there. I mean, all this, every step of the way in the whole care pathway, it can make a huge difference. And ultimately, it offers solutions. We are seeing that. I've shown you examples to promote sustainability. And I'm going to end with by saying that I hope in this talk you've already seen concrete examples that give you the confidence that we are in the right direction, and there is so much more we can do. And I am super passionate about creating value with data and AI, and I feel this is only the beginning. We can make a whole lot of difference together, not alone, together. Thank you very much. All right, bye for now.